know. Oh, if we're going to bring it back, then I have a whole bunch of questions. If we're not going to bring it back, then I want to go forward. I mean...
Okay, well, you know...
I don't know. I have thousands of questions. I'm ready to burst. I'm the healthcare expert for 20 damn years, and everyone keeps avoiding it. I've got my master's in healthcare. You cannot get those numbers. The high risk, I'll give you the numbers in high risk. Essex County jumped 150% of the premiums were high risk Essex County. All my seniors, their insurance have doubled and tripled. Blue Cross itself tripled. We cannot guarantee a high risk factor. Essex County is a high risk factor. Okay, Medicare. I can give, now, when you're saying this is not going to affect everyone, it's baloney, because the high risk will affect everyone's premium. I can help Mr. Cafaso, because you know what? I can put you on the uncompensated health care to balance out your copays, to get your deductibles and everything else. But the fact is, every taxpayer in Massachusetts will pay for it. So when you say it doesn't affect everyone, it does. Second of all, when your insurance, you put them into the city, and when you say Blue Cross, and the reason why I asked Donna about those two questions to repeat, because Blue Cross is so far behind and their heads are so far up wherever it is, they're not even informing people of what's going on. I informed her in April about something that happened in January, and our own city employees didn't even know. We had children with MS that didn't have any coverage because Blue Cross did not let them know. So we don't know what the high-risk factors. Let me tell you something. You call Congressman Taney, because we've been working on this very close. Essex County, and we are paying through the nose because of it. We are being punished. Our seniors are being punished across Essex County because we are a high risk. So when you tell me that these seniors, and no offense, you're high risk, with these seniors telling me that they're not going to jeopardize every single one. And as far as unpopular vote, you know what, not for nothing. I've had it up to here because I'm sorry, Mr. Mayor, I know, I love you to death, high regards, 600,000, that's baloney. It was 207, you said 600,000, went down to 400,000, 208, 288. You set up the trust, the high risk, we're not going to have a savings and everyone's going to be screwed. Second of all, to say that it's going to go to the school, I have a budget and finance committee. To say it's going to go to the school is ludicrous because we don't know where any money's going to go. We have sewer problems. I fell down and I have a safety problem because the fact is I want my fire stations open. I want my police to protect me. I was a volunteer judge on Friday, fell down at O'Malley School because there was no lights and a pothole's the size of my ass, and you know. You picked me up, Mr. Mayor, and the fact is, they had to call an ambulance, they had to call the police department, safety. We're closing down fire stations, we're close. So to say that we're all the school, so don't tell me that I'm against schools because you know what, I volunteer, I love the schools. But we're in such a mess with sewers and everything else, and for 1971 this was looked at, and when someone says, why didn't it look 36 years to bring this forward? I've been on this council for 5 years, health advocate, and you threw me, half of you threw me out of your classroom because I had a big mouth, so unpopular vote, I don't care. Unpopular vote, that doesn't frighten me because half of you threw me out and I got my master's degree because you threw me out.
All right.
You can't get the numbers.
Okay.
Not for nothing, but they said GIC, this is from 2007 May. Over the past 3 years, the GIC has, by and large, been able to keep increases far below both statute as well as national averages in FY07. The GIC beat the market with an average increase of 7.5 in over 8-year period registers an average increase, but below the GIC. What are we comparing? And let me tell you about copays. You want to go on about copays? You want to go about prescriptions, deductibles, and everything else? I can give them better if they were on Medicare, but you know what? Some of them can't get Medicare. And let me tell you something else. When you're looking at those 3 different plans, we don't have physicians who will take Blue 65. We don't have physicians who will take the Tufts Preferred. They'll only take existing. I'm turning my seniors away from this city, and you're going to put them on. Where are they going to go?
Okay. The question isn't, Council.
And that was just a briefing.
I know, but the question isn't on if they're high risk. Well, we know they're high risk. It's how it affects the plan is the number we're looking for. That's the number we're looking for in the analysis.
You don't have the number, and those numbers are incorrect.
Well, that's what I'm asking as the council.
I would take exception to those numbers are the best numbers that we have available to us based on what we're given with the GIC and what we have from the city.
Okay,
If you may dispute that, I invite you to go out and get them yourself.
Okay, again.
Just forward, councilor. And you shouldn't be doing the presentation. You rep the whole city, not just yourself. You shouldn't be putting this. She should be putting this on and getting those numbers. She works for us.
I'm going to call a 5-minute recess. Come on, guys. We've got to get it together. Set it off.